So hello, everyone. My name is Ari Maharaj. I use he, him pronouns, and I'm joined by my colleague, Jose.
Hi, everyone. I'm Jose Lavigne. We'll present ourselves later. So this is part 2 of our webinar. This is a fall webinar for supporting teachers.
I am NEDIC's Outreach and Education Coordinator. I use he, him pronouns, and I'm based in Toronto, Ontario, and I'm actually in Treaty 13 territory at the moment, but usually based in Toronto, Ontario.
I'm José Lavigne. We are located at ANEB, so Anorexia and Bulimia Québec. We are located on the West Island in Montreal. I'm the Prevention and Education Coordinator, so very much like Ari, but in Quebec.
If I see folks already introducing themselves in the chat, and so if you don't mind saying who you are and where you're tuning in from, in part 1 of the spring webinar on this, which we'll link again at the end in case you missed it. There's no real duplication of content. It's kind of just an add-on in the way that we're going to be supporting educators. And we had folks from all across the country in attendance last time, and a lot of people have viewed the recording of the webinar, which you're going to get to. So any of these slides are things that you are going to get, and the video recording of this too. We're also going to share some a teaching tool that I recently stumbled on called Indigenous Watchdog. The way I was trained to do land acknowledgements is always to personalize them. And so what's on my mind here is sharing a really tangible resources around the truth and reconciliation calls to action. And why I really love this website is because I think it's Indigenous led and it keeps people accountable as to the status of the calls to action. Some of them, most of them are to our governments, federal, provincial, territory, but some of them are to healthcare and some of them around education. And so it's really wonderful for you to take a look. If any of you, I think especially are teaching kids around curriculum and you're looking for ways they can have advocacy around some of these calls to action and really be allies in this conversation or be supporters of it, I'm going to link this site into the chat. I think it's a really wonderful resource and will be our land acknowledgement in these virtual times at the moment. So thank you so much for taking the time to entertain that. So our goals for the webinar are plentiful. We're going to try to cover and engage in a discussion around some of the physical and mental health impacts that folks might have been noticing around the COVID-19 pandemic. And we'll have a conversation around making school a safe space and what it means to take a whole school approach and really look at the environment that all of our students are in. And Jose is going to give an awesome example in Quebec around a weight stigma manifesto where they're trying to do that in a more comprehensive way.
We'll also be looking at body image. What is body image exactly? And in terms of embodiment and how that can be applicable to your students, yourself, and to everyone else, and its impact on mental health. We're going to look at exercise and diet culture and how this can affect people who are already vulnerable, but also to have a critical eye on what's going on in the media as well. We'll give you 2 examples, a little bit different from the spring one, from our body image, our partner Dove, so that you can apply this in your classroom if you'd like. And we'll be also lastly outlining the different services that we can help you with, either for yourself or for your students. So before we start, we'd like to open either the chat room or if you are comfortable speaking up, we'd like to see your impact, what you've noticed about the impact on COVID on your students. If you've noticed any differences from last year, for example, and this year. And then we'll look at a study that was done by Sick Kids, the hospital in Toronto. So we'd like to open the floor right now.
And
feel
we
free
asked that
to.
question in the chat too, so folks can chime in. While folks are typing, Jose, any things that you've noticed on your end, and I can share on mine too.
For sure. We have an answer here in the chat. Okay. That's fine. What we've noticed on our end, obviously, it's been difficult for everyone, especially youth, because of the isolation, and also more time spent at home on the screens, and how it can impact even their learning abilities. And so this is what we've noticed, and it's been documented now that it's obviously the health component and health issues that come up that have been rising, and we'll get into the study. Is there anyone else who'd like to share? So from Krista, we have had eating disorders, anxiety, and other mental health issues at our school. Since the pandemic, the numbers seem to have really went up. Yeah, and we can there are studies that confirm that on our end. Huge increase in eating disorders at our high school.
I hear you, Krista, on the piece you're mentioning around like concurrent mental health issues too, around suicide and overdose. NEDIC and ANEB don't necessarily advertise ourselves as crisis lines, but we certainly hear a lot of conversations around that from people of all ages, but I think especially our young people who are really struggling, especially in that transition, the transition maybe to high school from elementary or from high school to whatever comes after high school for a lot of people. Because these things don't really occur in isolation. So I really appreciate you bringing that up.
So thank you. And Chrisula, you mentioned anxiety, of course. So as Ari had mentioned, mental health issues that come up. And so we'll now look at the specific study that was done in Ontario and see what they've noticed. So obviously, like you've stated, an impact on the health, mental health, especially if you look at also the fact that there are no school activities. It limits the social interaction for youth, especially. And this is interesting as well. Increased screen time because of lockdowns meant more irritability, depression, hyperactivity, inattention, and anxiety. So I can just imagine as teachers teaching for a while online, how it must have been difficult for you. But as well to get your students to be excited about learning and all that.
We also want to spend a little bit of time talking about the social determinants of health. So sometimes we get really focused in talking about biological factors and individual factors when we talk about mental health. And I think especially with COVID, I think these systemic factors have been ever more apparent. When people don't have access to safe housing or an adequate amount of food or access to healthcare services if they are struggling, all of that can only serve to exacerbate mental health conditions that might be there before or might contribute to the development of them. And I think one thing that's really hard with these issues is I feel like a lot of us now especially know that these things exist, but then it's really hard to know like what to do with this information. And I don't think it's anyone's fault here. I think like a lot of folks, including folks in our medical profession and others, just don't have a lot of training around these issues. And so it's one of the reasons why we're really thankful to be engaging in this conversation with you today. And by recording it and sharing this information more widely, hopefully you being able to share this with your networks, we can kind of engage in a little bit more of an unpacking of what it might look like to try to communicate these social determinants of health in a way that's also going to make sense on an individual level. When we think about that, I really like some of the quotes on this slide. So Harrison Davis says, our families and communities greatly contribute to our values and our opinions about others. Consider them filters. It's easy for us to identify evidence that confirms the opinions we've heard as kids, but the danger is when we overlook situations that dispute stereotypes about others. And I think you can imagine times where we hear stereotypes about people around race or around body size or around ability. And depending on what we've heard in our family environment or from our social environment or what we've been told by media or what we've been told by healthcare, it might really impact the way a person, and especially a young person, might think about themselves. We really like to take a stance in EDIC and ANEB around cultural humility, noting that our students are the experts of their lived experience of their own cultures. And our task is to make sure we aren't projecting our experiences or our assumptions of culture or identity onto them. But instead, I think you'll hear today about ways we can ask questions and learn curiously alongside them. We'll never know where an individual falls on the population curve of certain traits or aspects associated with an identity, because every person is unique and can't be adequately studied. And so we need to start from a place, and instead of trying to problem solve immediately, can we accept and respect where people are at? And to that end, that Kenneth Hardy quote is one that I really, really love. I think what we can do is help students name things. So Kenneth says, when a condition lacks a name, it lacks an acknowledgement. When it lacks an acknowledgement, it lacks validation. When it lacks validation, it lacks care. Help your students name things. Being able to let them know that it's a legit reason that maybe you haven't been eating, or maybe you're eating too much, or maybe you're feeling like you need to cope with your emotions, or maybe you're down on your body image. Like, all of those things matter for whatever reason that is. And let's talk as equals about what we can do about it. That can always be a place to start. And I think one that comes from a place of acceptance without us feeling like we have to jump in and solve problems. And so we'll turn our conversation to how we can maybe create a safe space along this environment as a whole. And we'll give you some examples of that.
So we'd like to start with some statistics so that you know how relevant it is to speak about stigmatization and intimidation linked to weight and appearances. This study was done by the Quebec Public Health Association, but we feel it might be representative of other provinces. They determined that the first cause of intimidation in school was based on weight and appearances. So knowing that, it's important as important actors in students' lives to be aware of this and to prevent or help students, particularly anyone who's different, and we'll speak about that later, but any form of intimidation, to speak about it openly and have a safe space, which we will also mention later on, but so that students can come to you and speak freely. And also these other statistics are worrisome. 47% of youth that were victims of bullying because of their weight have developed an obsession about their weight, and we know that this can trigger an eating disorder. It's also important to note in our society today, even though there is in 2021 a lot of work that is done, there is still a lot of work that needs to be done on fat phobia. In French, we say la grossophobie. We have to address this at school, in our communities, and so that people can understand it's okay to have a diversity in weight and appearances, and to really recognize that. And again, having an open discussion about diversity. And what are the consequences? Well, as you probably know, the consequences of being bullied are pretty severe. So symptoms of mental health problems, depressive or anxious disorders, low self-esteem, social discrimination, and it goes on, and obviously can lead to developing an eating disorder. What's interesting is that, as I had mentioned, there are actors, there are key people in our society that are making changes. One of them that ANEB took part in was a group study where different people in Quebec were reunited to address these the preoccupation that the province has, but again, this could be applied to other provinces in Canada and elsewhere in the world, or mostly in North America, if we can say that, or it's to address words and how we communicate when we speak about weight, when we speak about obesity. We have to address fat phobia and other issues that are related. So there is a manifesto being done. It's not ready for public use yet, but if you are interested, there is a link here to another website that goes that brings you to Quebec Weight Coalition, and that is so it should be available for you at the end of 2021 or 2022. And what we focused on was 5 key elements. So deconstructing prejudices, simplifying messages so the messages to the general public is clear, erasing guilt and shame around people who may have bigger bodies, communicating without harm, and finally focus on empowerment.
Yeah, I'm seeing some notes in the chat too about how language is so important. And then part 1 of this webinar, which I'll link again in the chat at the end, Jose and I got a chance to go through some of our language suggestions. And again, I don't think anything is perfect here. I think perfection is like an enemy of progress and can sometimes really stall conversation. But that webinar might have some examples around food and bodies and health that we can use. And Jose and I a little bit later are going to be talking about exercise and ways we can kind of navigate that. To add on to what Jose was explaining though, I feel like when you're also looking at ways in which we can contribute to the elimination of fat phobia in our schools, I think we also have to think about the way in which students aren't just one thing, they're always multiple things. And I've been seeing a lot more work recently that's much needed around helping our 2S LGBTQ community members in schools. Some recent statistics have shown that members of that community experience eating disorders at up to 5 times the rate of their cisgender heterosexual peers, and that LGBT students in high school especially are at much higher risk of harassment and assault, which are really awful things. People who just don't conform to society's expectations around gender suffer from discrimination societally and interpersonally, and sometimes have difficult family relationships and low self-esteem in addition to other things. There was a really wonderful study that's linked there by Overno, Bishop, and Russell in 2021 that found that when teachers undergo professional development training on issues related to sexual and gender identity, all students, regardless of identity, reported a more positive school climate. So it means that all the work that you're currently doing to champion this is working in the sense that you're creating a more accepting school environment for everyone, even though we're maybe getting some specific training on issues related to equity or to some underserved communities. And I think the same thing is true for eating disorder prevention. So even if you might not have a school training around eating disorders specifically, know that all of this is related, and the way in which we're helping our schools be more safe for queer folks and for gender non-binary folks, we're also going to help with their mental health outcomes at the same time. And so I find these studies, sometimes we talk about all the negative things, and I found these studies really empowering to help us going forward. And I really appreciate the comment that we're getting in the chat here around ways in which weight and our identity around gender and sexual orientation can sometimes intersect and can still be like almost a lifelong challenge for some of us. And I really appreciate folks sharing that.
So thank you, Michael, in the chat there for your story. To understand what an eating disorder is, we have to understand how complex it is. And we had addressed it in the spring edition of the webinar, but we'll go through it again. And this is a tool that we use at ANEB, and NEDIC uses a similar tool. And it really gives you a perspective on how complex an eating disorder is. So an eating disorder, these predisposing factors can be dormant, and we'll get into the precipitating factors that can kind of help develop an eating disorder in someone. But if you look at these 4 factors, so the individual factors, for example, a low self-esteem, difficulty with body image, perfectionism, in the familial factor, past or present abuse, much importance on performance as a whole. Social factors, obviously the beauty standards, and this idea that to be thin is much better. Genetics plays a big role as well. If there's mood disorders, other substance abuse or whatnot, and obviously if there's been eating disorders in the family, this makes the individual more susceptible to develop an eating disorder. So again, this can be dormant, but there might be something in someone's life that triggers the development of the eating disorder. These triggers can be, for example, COVID-19. So something that is anxiety, that brings out a lot of anxiety for some folks. Forms of abuse, if there's a loss or a separation. What we've noticed in youth is if they go from primary school to secondary school, and all of this is also related to who are the people more at risk. And unfortunately, youth are more at risk of developing an eating disorder. Any questions about this? Okay.
I'll hang tight for a second. And we're going to focus a little bit now on body image. Joseph going to walk through, and then exercise, and then diet culture as some examples of this tool. But just know that there's a lot more here than we're talking about, and we're just going to focus on a couple just to try to keep the scope tight on this presentation. Okay. We'll interrupt if we see questions, but I'm going to keep going for sure.
So what do body image struggles look like? So honestly, it can represent in anyone. So if you look at the right side, it can be an athlete, for example. In the middle, it can be youth, no matter their culture. It can be also in someone who's older. It doesn't matter what race, what age, what culture, what sexual orientation, what gender. It really, body image it can also be, we'll have a look at more precisely what it means to have body image. What is body image? But as you can see, everyone is affected by body image. So body image, what is it exactly? It's your thoughts and your feelings towards your own body, and it's not static. So if we see different quotes, for example, I am unhappy with my body. This is something that you might feel. I put up with my body. This is also something that you might feel during the same day. I might not love my body, but I respect it and take care of it anyway. This is positive body image. And finally, I do not feel limited by how I feel in my body or what I think about it. My body is what allows me to express myself and go after my goals and passions. So this is what we try to reinforce. So if someone wants to chat or wants to talk about their own feelings about their own bodies.
I know one thing that stands out to me while we're seeing folks respond to the comment in the chat is I didn't know any of these things here counted as body image when I was growing up. And I feel like it wasn't until I probably started working in eating disorders that I like knew that it could be more than just like how I feel about myself, that like not loving my body is an actual option, and that like respecting it and taking care of it because it's the vessel I move through life with, like that's an okay place to be for body image, because I didn't know like loving my body just felt so out of my reality. Like I never thought that I might have been able to get there. Anyone else in the chat, what stands out to you about these statements, or how many of you have felt any of these? Obviously, these are like deeper questions, and so no, don't feel like you have to share, but we wanted to take a moment to pause here and let you share if you'd like to. Jose, anything stand out to you about yours?
About my own experience with my body? I feel I agree with all of these quotes, and what I'd add is, as I stated, it really varies. It's not static. Depending on what I do, I feel like when I move, I feel a lot better in my body, or if I relax as well, like if I take a bath or something like that, or I'm at the spa or something, that can also influence. So I think it's important to know that it varies. And the important thing because we are in the eating disorders setting, is that it's important for us to remind our patients or clients or users that you can feel all of these things about your body, and it's okay, it's natural. And at the base, someone who has a poor body image, they probably never really feel okay with the body they're in. So it's going from there to helping understand what your body can make you do. Sometimes it takes a lot of time. Obviously, if you have an eating disorder, it takes a lot more time to go from having an eating disorder to appreciating the body you were made with.
Shall we read out some of the comments in the chat?
Yeah,
And maybe Jose, you can start, but we won't read out anyone's names because we know it's going to be in the recording, but maybe we can just read out the comments that are there because I think they're really important. We'll just alternate if Jose, you want to take the first one.
Yeah. So Michael, again, thank you for sharing. Body dysmorphia is something that we're obviously still there's a big link with eating disorders, and it's important to address this as well. There are great similarities between both.
I see a person saying body positivity is sometimes promoted as the ideal, and sometimes I feel like it's a lot to ask for in the culture we live in. Neutrality might be good enough. In my case, I didn't ever think neutrality was an option, because like someone else mentions, like what happens if you're feeling stressed to love your body? I think we don't
Mhm.
talk about that stress enough. Like sometimes the stress to feel like we have to love our body,
Mhm.
or
Mhm.
that we shouldn't hate our body, or whatever way that we're framing it. Just being like, it's just okay to have a body and exist in it. I agree with the comment that someone said around like that in itself can be really liberating.
Yeah, yeah. Um,
We have another comment. I feel like a big shift in how I've been teaching body
yeah.
images around loving what a body can do rather than what it looks like. Seeing our
Mhm.
body as capable rather than something to be critiqued at a visual level. Our bodies do so much for us, and helping students realize that's important distinction.
Mhm.
We
Mhm.
can still respect and take care of it.
Yeah,
Yeah, and
I
even when we think about medical labels, like
yep.
obesity is a medical label that I feel like lots of folks
Mhm.
have feelings on. I really want to emphasize that even folks working in that field now is starting to experience a shift where they realize that shaming people for the weight that their body is at or being in the body that they're in doesn't lead to any supposed health changes that are supposed to come from it anyways.
Yeah.
A person in the chat's mentioned health at every size is one example of like a paradigm that's meant to try to kind of reframe that a little bit.
Yep.
Um, and it's really important to keep in mind like all of the different ways that this also interacts with like social justice frameworks around there needing to sometimes be a systemic shift around those social determinants we talked about at the beginning of the webinar, and ones that we're going to focus in a second around exercise, for instance, as being all part of this. Because it's not that we don't want um, folks to be quote unquote healthy, but it's letting them decide what that is for them instead of us kind of, they're already seeing so many different healthy ideals, and putting another one into people's face often isn't a good way to get them to make any changes if they need to make them. And
Mm.
who's to say they even have to make changes?
Mhm. I feel as well that we should know that we address this idea of having healthy living habits that you can put in practice every day, not just something that you're comfortable with. And we will see that later on, how movement can help you, but really define what it is. How can you be comfortable in the body you were given?
Mhm.
So as you see, body image is not static. You can feel really good about your body. You can feel a little not as good in your own skin, but it's important to know that it varies, and also to understand how important it is to keep healthy habits. And what I mean by healthy is making sure that you're moving, and we'll talk about that later on, but you're moving and you're eating the way that makes you comfortable, and makes you do the things that you'd like to do.
These next two slides are going to focus on introducing the concept of embodiment. And Dr. Neva Paran has done a lot of work in Canada on this, some of which with athletes, some of which with young girls, and some of which with folks of all genders. Embodiment is a way to think about how we might feel in our bodies, and can sometimes help us understand how it might impact our engagement with the world. We want everyone, and especially our young folks, to have an embodied experience where they feel connected, they feel like they're able to what they want to do, they're able to understand what comfort and desire might feel like. And it's a way that like sex education also plays a part here. They feel like they can be attuned to their own needs. I think sometimes I feel like self-care has become corporatized, but to me, it's just about being attuned to our needs emotionally or physically or bodily or physiologically. Um, and fundamentally feel free from disempowerment. And so, what might this look like, or what might this sound like? Um, Expressing our voice might mean staying true to our values and feeling like we have that courage to be able to explain that. Feeling capable in our body might not always mean something around functionality. That can sometimes be ableist and like leave out folks with physical disabilities, but can be about practicing challenging skills. I might feel really capable with my hands if I can knit or crochet or cross stitch more complex patterns with them. Like that's a challenging skill for me. I've never done any of that. That might help me feel really capable. But sometimes I feel like we don't talk about those things in this way. We sometimes talk about capability in like the athletic sporty kind of way, which not everyone is gonna find true to them. And something like attuned self-care might just look like adequate sleep. And so when we're talking with our students, some examples around ways that you might be able to teach embodiment a little bit is asking our young people, like, what do they admire in other people? And what do they value in themselves? And what really matters? Sometimes it's a way to add perspective to a conversation. And we can then, in our feedback, focus their goals on feeling grounded in their bodily experience. Because one thing I really love about embodiment myself is that, especially for kids going through puberty, they're noticing so many changes every single day. And some of the ways that our body might be changing can also cause a lot of anxiety in them. But these fundamental things don't have to change during puberty, like caring for our body, expressing our voice and using our voice, following our passions. They don't suddenly have to be disinhibited with that. Often society is acting to disinhibit people for those reasons. And I think we, by focusing not just on physical body image, but about the way in which we can feel in our bodies, can let them know that they can still have that courage, or they might still be able to follow that passion, or they might still be able to care for themselves. And it might just look a little different, but it's the same things we were doing at 8 and 9 and 10, or whatever it was pre-puberty. Anyone have any questions about that? Does it make sense? Does it feel right for you? Thanks, Jen. Okay, I'll see questions as they pop up, but I'm going to keep going, but feel free to pop questions in as we go. Some things that I think help us do this is, like we said at the very beginning, how can we now expand this to school-wide approaches, kind of comprehensive school help? So far, we've been kind of focusing on some different means of doing that. And I think this list, while you don't have to go through all of them, is just meant to kind of like stir your thoughts and your ideas that you might be able to apply in your setting. So some of these are really generalized, but try your best to see how you can adapt them for you. So let's talk policy. What might taking a whole school approach around combating fat phobia and creating more embodied school spaces look like? You could include a statement in the school mission about providing a body inclusive school environment that celebrates diversity in all of the ways and including size. I like rarely see size mentioned in those ways. And that's maybe, I think, one of the ways in which we think that we can change body size because of all the messages we have. So including a statement like that when we're talking about diversity is something that seems really cool. You can also ensure that there's no weighing or measuring or assessing of students in any context in that way. I know in Ontario, like when I went to school, we still weighed kids in gym class, and you had to kind of do that in front of everyone. And a lot of athlete programs, they still do that. If you have to weigh, do it blind, like a blind way where the person doesn't know, or do it in private, or really make sure it's functionally important for them. But needing to do that on a public health kind of basis, there really isn't a lot of evidence for that at all. In curriculum, what are some ideas? So Jose and I are going to give you some direct examples from our Beyond Images and Au-delà de l'Image curriculum, but integrating some of this work into an age-appropriate manner can look like exploring the influence of different societies and cultures on body image and healthy lifestyles in history or geography or social studies. Integrating body image awareness into English and the arts by like dissecting advertisements or having visual depictions of bodies in different ways. Or discussing things like diet and exercise and the medicalness of all of this in biology. Those are all some curriculum ideas too. And I see one in the chat around adding critical food literacy skill development to curricula can be important. So we can teach our kids how to strategically navigate our extremely obesogenic food environments. The portion sizes and the serving sizes and the foods in certain groups is a very different way in the way I learned about food, but not the way that we have to teach kids about food. And community. Can we help make available up-to-date information about how parents can support their child to develop a positive body image and healthy relationship with food? And Nedic and ANEB will talk about ways we can help with that in a sec. And we can present talks or info nights for parents and people around our young people, not just them, but their influencers. How do we help the folks who matter to them, their coaches, their parents, the rec leaders around this issue so they know too. So the young person and the teacher doesn't have to feel like everything's on. I'm getting some extra ideas in the chat, so feel free to pop them in there and I'll keep reading them out loud. Person saying, teach kids how to practice mindful eating and tasting, kind of like responding to their own body cues. And yeah, being able to really do that in a developmental appropriate manner is important. Ellen Satter, a dietitian in basically the US, has done some really wonderful work around this area too. And someone else is saying, kind of using your senses for that. Like, how does food taste or feel or smell? Because it's more than just fuel that goes into our body. It's an experience in many ways. I've talked about when I get to visit classrooms, like mukbang videos, initially coming out of Korean culture, but I think a lot of cultures have maybe similar ones where you're watching someone eat food and getting to explore the social element of having a meal with someone, which can feel weird virtually, but can sometimes feel and replicate some of that family meal environment if family isn't a supportive person for them. Some more ideas: don't label food, refer to it by its name. Candy is candy, apples are apples, don't group it. Take away some of the moral superiority that's placed on some foods. Yeah, these are awesome ideas. And so when we think about exercise specifically, I'm really curious if you all can take a look at some of these examples of how diet culture shows up in exercise and movement, and let us know in the chat, do any of these resonate with you? Are there any examples that you've seen in your lives or in your school environments that you see often? And Jose, anyone's that you see, if you want to speak to any of these?
Obviously believing that only small and or fit bodies can be healthy. I think that's a generalized idea or perception.
Someone saying in the chat, so many of these are normalized and celebrated. And I think that's what makes this conversation really hard. Jose did a really awesome job explaining some of the physical and mental health impacts, and you all have shared that too at the beginning of the webinar. One of the ones that we've heard most often is around the way in which when exercise routines changed and when gyms changed and people's understanding of fitness changed, that was really starting to exacerbate our conversations about this. And that's really hard. Yeah, someone's saying, I say exercise is practicing good internal hygiene is a different frame, keeping the bloodstream clean, because it helps reframe it from outside looks to internal health. It's a really awesome strategy. Someone else is saying, it pains me to see well-meaning educators using running laps or doing push-ups as punishment. And kids then start to associate those activities with punishment, referring to that exercise one. Society's kind of shifting to try to make it as if it makes us feel good and for our mental health, but it still keeps that guilt if we don't do it. And I think that's the really hard part. I find it really hard as someone working in eating disorders to then talk to someone about exercise. They're like, well, you're just thinking about it in this way. and exercise is obviously good for your mental health. And I don't think anyone in this field is ever debating that that is true for a lot of people. We just also have to be mindful of that moderation piece where it's not going to be beneficial for everyone, and that you need to have more coping skills than just one, and that the diet culture messages that we see, as Jose is going to talk about in the next slide, can really disguise itself in exercise messaging for sure. I'm going to go to Jose for your next slide, but I will just say that this slide, when you get it, helping, I think it's a really nice way to, like it has with all of you, open up conversation with our students. So I've shown this in classes like grade 9, 10, 11, 12 classes, especially health classes that I get to guest speak in. And I know ANEB does conferences in school in a similar way. These are all conversations that we can have if we help our students understand, like, oh, exercise is punishment, like that's bad. Like even that's an important conversation to have with someone, because they might not be recognizing that yet. And I think we can help them do that by framing it in this way around having conversations around physical activity.
So one of our conferences deals with exploring, trying to see images with a critical eye, and it's not always that obvious, knowing, for example, that the diet industry is $1 billion industry, and it works well because there's a lot of people who have tried, who are trying diets. And we know that they don't work. So that's the important thing to understand. And people who are vulnerable, who have poor body image, might easily get into these fads or these trends or these ways of trying to lose weight. So it's very important as educators with us here at ANEB or NEDIC to make people understand how important it is to have a critical eye on everything that is shown to us in terms of the exercise and movement in the diet culture especially. And again, as we had already mentioned, the diet culture can bring up some issues as well, such as this idea that being in a smaller body makes you healthier, when we know that it's not correct. And movement, bringing movement in a positive way and not basing it on appearances, but really how you feel in a specific activity, physical activity, or this idea of movement where, and it's very specific to every individual. So again, knowing this and having a critical eye is very important.
We had these kinds of slide formats in part 1 a lot, but here are some recommendations, again, that are really generalized, but we trust you to adapt them to your context. Some things on what to do and some examples on maybe what not to do around trying to take an embodied approach to movement. And so I think I'll give everyone a minute or so just to read this and let us know if you have any questions, and I'll highlight some of my favorites. One of the ones I'll highlight is, like we've talked about with food in the chat so far, taking numbers out of talk about movement. So like, what a lovely day to go outside for a walk, instead of how many steps did you take yesterday? Like, I think we talk so much about steps because of Fitbits and track counters, which are so similar to calorie counters. And I think it's a very similar kind of like rabbit hole where people get stuck in. Talking about how lovely it is to go out for a walk, or it sounds like hiking with your family was time well spent this weekend. Kind of remove some of the morality and the obsessiveness around it. You can just talk about how you feel in your body for that. So again, I'm not going to spend too much time here. Again, feel free to pop questions in the chat about them, but you're going to get these slides as some recommendations that you can kind of take to folks in your life and students that you work with around ways to apply some of this for yourself.
So in the spring edition of the webinar, we had mentioned how you as teachers, educators can include in your curriculum some programs that were designed by teachers in the Toronto, from the Toronto District School Board, and who are really made for students and teachers. It's a key in hand kind of programs. It's made for grades 4 to 8. And there are different ways to access these programs, either on NEDIC site, directly on the ANEB site, or au-delà de l'image.ca. And we'd like to give you 2 examples today. One for grade 4, lesson 5, called Blogging for Friendship and Self-Esteem. And really what it is, we'll go through the actual program so that you can have an idea of what it looks like.
This is just how you might access it. When you go to the Au-delà de l'image site and you access the curriculum, you'll see the different, there's 5 lessons for each grade. So if I hit lesson 5 on the English version for Beyond Images, just knowing that most of you here are thinking about it that way, I'm just going to scroll through this as Jose speaks.
Yeah. So as you can see, there's a kind of a little lesson plan here so that you have an idea of what it consists of. There are videos that you can show your class. And this specific program was designed to for students to write on what it is to have a good self-esteem. And there are different ways. They suggest different ways of doing that. Can be very creative. They can rap. They can do a variety of things. So these are some of the activities that you might see. Everything is free, very easily accessible. Okay, so how it can develop into a project? Well, it can be very artistic, like a rap or a chant or a poem. So this could be a fun activity, a learning activity that you can do for your students, with your students, I should say.
Another example is grade 7, lesson 3. So we've talked about some of the ideals that people might have around body image or around weight or around exercise. And this lesson really talks about trying to capture different ideals, true ideals in and around us. Again, developmentally appropriate. So Jose's lesson, appropriate for grade 4, this one for grade 7. And what it results in is a photo essay of images that capture and appreciate beauty in the world around us. The rocks, the winds, the sails, music, helping students reflect on being a responsible media consumer and creator, and knowing that there's more to our value than just appearance. And this lesson is linked to visual arts and language arts. So on the Beyond Images site, grade 7, lesson 3, holds you at this, and like Jose's walked you through, summary, what materials you need, and maybe some media clips, some curriculum outcomes that are here, and then a lesson outline to help you facilitate this as you feel like you want to. As we keep going, some reflections to write, and responsible media kind of thoughts, and core concepts of media literacy, and it goes on. There's some questions in the chat around at what age should we be talking about body image at the elementary school level? These curriculum tools started from grades 4. We're feeling like even from then for a lot of students pre-puberty is a really wonderful place to kind of get them already thinking about it, and doing that with all genders, not just with girls, which is often the focus for a lot of people. I think making sure that everyone gets this information. And I think I've heard teachers customizing these materials for younger audiences, and that's the beauty of it. Like Jose said, turn two. So you get the curriculums and you can customize them for older, you can customize them for younger, feel free to. But the curriculum expectations that are linked to across Canada are from grades 4 to 8. And that's where teachers can find a really natural link between what you're supposed to be teaching to and the lessons that you see here. Thanks for asking. The final thing I'll say is, when you're thinking about evidence-based program delivery, you'll notice that all of these pieces for youth that we've shared, even the exercise and diet culture pieces, didn't specifically talk about eating disorders, and that's on purpose. You can always reach out if you notice eating disorders to NEDIC or ANEB. We have the national and English and French helplines for people to call or connect with if you're worried about students in that way. But we're really trying to focus on the risk factors that Jose mentioned around body image or media literacy or over-exercise or nutrition. And like we've seen in the chat, who you are is extremely important. Your own attitudes and behaviors towards food, weight, and shape can be broadcast to our students, even if we don't want to or not. And we've tried, even today, as we've had discussions, to try to be experiential and have this over the course of a week or for 4 Mondays in a month or something like that. And knowing that it's not just relevant to one curriculum topic, like just health or just language or just social studies, but being able to know that it goes beyond that. There are some wonderful comments on the chat about this around folks saying that we can model and foster an inclusive environment at all ages. And then if it comes up with a student, you have a way of addressing it, which is, I think, a really wonderful suggestion. We have to be real with our kids, and we feel, at least with the tools that are here, they're aligned to those curriculum expectations for those ages. But I think kids as young as they are can have real conversations about body and about body image and appearance. There's some great book recommendations in the chat that I'm just going to read out loud. Shapesville, The Body Book, I Like Myself by Karen Beaumont, and Bodies Are Cool by Tyler Fetter. And when you do go to the websites, as you can see here, sorry, yeah, when you'll have to go and sign up for, it's free. You just go in and put in your email and put in who you're reaching out to. Like, I'm gonna present this to students in grade 7 or at a school or at a community center, just so it gives us a sense of, like, is this being used and is it actually being useful? And then you get free access to this site here where you can see all the different lesson plans. So when you hit the curriculum on your end, it'll help you see that. I know that we're at time, and so I'm just going to wrap up with resources on NEDIC end and ANEB's end for Jose. These are NEDIC's helpline hours, both a telephone helpline and an online chat that anyone can reach out to, including teachers who are worried about their students. We can hear more about your situation and give specific resources if you'd like it, or give you other resources about these issues. And in particular, we have free resources for educators through our community education page. So if you ever want to learn more about the work that we do in schools for different audiences, or the work we do with parents, or further professional development for educators, you can go through and click that page on our website under Get Involved and Community Education. I'm going to go to Jose.
ANEB has, so ANEB will be celebrating its 35th year in 2022. We cover all the Quebec province, but we also welcome any Francophone reaching out to us from outside of Quebec. The most available resources are our help and reference line, which is open every day, Monday to Sunday from 8 to 3. We also have, like the NEDIC, we have a chat service, a texting service, emails. two websites, anebquebec.com and anebado.com for youth. And we also have open and closed support groups and other things. In terms of education now, what we can offer, we do conferences in schools and community organizations for professionals such as yourselves as well. And these are the three main ones that we give. So for secondaire 1 to 1, so for older students getting past the filters, it's helping them to have a critical eye on beauty standards. We also have one on self-esteem and body image and one on eating disorders. We also have kiosks and professional training sessions that are done at ANEB. And all our conferences are, all our services are bilingual. Obviously, we're in Quebec, so it's more French, but we are a bilingual organization. And these are the way you can access our conferences on our website. It's through our services, and you just link on conferences or trainings, and then you can get to one of our services.
Otherwise, we just wanted to say thank you. We know that we have kept you for a few minutes over. Jose and I are going to stay back here if anyone has any questions that they would like to ask us, and know that you should get this recording and a copy of the slides likely next week. So you'll get that through your email on the same way that you registered for this. Yeah, these resources are going to be emailed to you. And both, if we haven't been clear, we apologize for that. Au-delà de l'image and Beyond Images are the same program. Au-delà de l'image is for French and Beyond Images in English, but they align. And so use that for whatever school audience you are, or student audience you're working with. I think if that's it, Jose, any closing words that you want to say before we stop the recording?
Just thanks for being there, and you know, hopefully you'll be having a good 2021-2022 school year. And if you have any questions, feel free to reach out. We are open to, if you have specific questions about the programs or any other question, feel free to contact us.